Hello, welcome to Local Edition. I'm Leslie Leyton. Black infant mortality is far greater than that of the rest of the population, and our next guest is working to change the tide. Please welcome Dr. Shene Bowie. She's with the Public Health Department, the Family Health Services with Black Infant Health. Welcome.
Thank you.
Now, explain the infant mortality of Black babies compared to the rest of the population.
Yeah, so the infant mortality rates in general, and this is nationally, it's statewide, it's also something that's local here in the county, are very different for African American babies than for other babies. So
why is that?
We don't know, and that's part of the reason for the program, for the Black Infant Health Program. So infant mortality rates have been declining over the years, but what doesn't change is the disparity between ethnicities. And so that is what we are focusing on and trying to figure out what that is.
So we need a program like this to identify the problem, I guess, and come up with some solutions.
Right. So we're in the process of identifying what could help, and not just in terms of prenatal care or the medical side, but what we're also learning in public health is that there are social determinants like stress reduction. There are environmental changes that can also take place to actually help the mom decrease her risk for preterm deliveries and other things that increase risk for infant mortality.
So you've identified some of the possible reasons now and some of the possible solutions. Right. I mean, how do you help your people that you're serving, and how do you identify them? How do they come to you, and at what point in their pregnancy?
Yes, that's an excellent question. So we are working with both medical providers and social service providers. So physician offices can refer, social offices like, churches or assistance, medical assistance or social service provider assistance programs, like Medi-Cal programs can refer. The women can also self-refer as long as they're 18 years or older, they're less than 26 weeks pregnant, and they self-identify as African American women. They can enroll in the program.
Mm-hmm. Does this program exist anywhere but here?
So it's actually a statewide program. Mm-hmm. It's in 15 other jurisdictions, or 15 total jurisdictions within the state, and we are one of them.
And what are some of the specific ways you've been able to help some of the people you serve?
So the program is just starting, so we are in active recruitment, and the ways that we assist are through group sessions. So it's social empowerment and group support. So we have sessions in group. We also have life planning with our social workers. We have in-home visits with our nurse. And then we also provide resources, general maternal child health resources to the mothers as well.
What are some of the messages that you try to get out to the mothers in terms of ways they can help prevent the horrible tragedy of a child dying?
Right, so because we don't know all of the reasons, we just try to make sure that the things that we do know, like social support and empowerment and reduction or stress reduction strategies. We do know that chronic exposure to stress can also increase the risk that a mom might have a preterm delivery, which is the risk for infant mortality. So the program specifically focuses on stress reduction and social empowerment.
Yeah, I hear what you're saying, because beyond just the health of the mother, there are those social issues that are so much more difficult to help people
Economics, housing, education, all of those things that you deal with. So we try to make sure there are a wealth of resources that we can give the mother.
And most of all, at least this first step here, that people know that these services exist and you're there to help.
Yes, and just want to make sure we know that right now we're serving Fontana, San Bernardino, Highland, Colton, and Rialto in the county.
Thank you so much
You're
for
welcome.
joining us today, and we're glad you could join us as well.